In your health tonight, identifying the cause for cold hands. Experts say it's not always a warm heart.
Cold hands, warm heart, that doesn't go hand in hand?
Well, it does, but she's the expert.
Here to explain is the expert, Dr. Abby Waldman, dermatologist and social media star at Brigham and Women's Hospital. So it's great to see you. Great to see you, by the way.
You as well.
So it's not cold hands, warm heart? Is that what it is? No, what?
Not always. There can be warning signs that you want to pay attention to when your hands are cold. If they turn color, if they turn white or purple, that is a warning sign that something else could be going on where you're not getting enough blood supply to your fingers. The most common cause of this is something called Raynaud's syndrome. Raynaud's disease. Basically, your hands turn from white to blue and then to red. It can happen just on its own, usually in young women, but it can be associated with some autoimmune diseases, so you want to pay attention. And it's not just the fingers, it can happen to the ears, the nose, the toes, and even the nipples.
Okay, well, there you go. Are there any treatments for this, doctor?
There are. Staying warm is key, so basically gloves, keeping your core warm with a big jacket, staying out of the cold if you can. And you want to be able to, if you're having little ulcers in your fingers or they're becoming symptomatic, you can talk to your doctor about treatments. There are blood pressure medicines you can consider and even Botox injections in the side of the fingers.
We're showing some images on the screen as we talk to you, doctor. So the question is, when do you encourage someone to talk to a doctor? I mean, right now it's what? It feels like temperature is 0 or below 0. Right. You'd expect to be cold, so you go, well, it's cold outside. At what point do you say, no, that's an issue?
You should always talk to your doctor if you're having these signs. You don't always need treatment for it, but it's good to know that you have this diagnosis. If you're having symptoms of autoimmune disease, particularly lupus and scleroderma, so if you're having joint pains, joint swellings, or rash, you should talk to your doctor. If you're having ulcerations in your fingers, you should talk to your doctor, or if you just want to control the symptoms, there are medications available.
All right, I'm going to ask you what I ask you all the time because you're a wonderful follow and you're so informative. Tell everybody where they can follow you.
On Instagram is abby.waldmanmd, and on TikTok is Dr. Abby6.
There it is.
Abby with a Y, right? Very good, Dr.
Abby with a Y.
Thanks, doctor.